welcome to another blog summary video. This month we covered a pretty exciting topic that's very important in the world of science and technology, and that is the field of genetics. So my blog is on personalized medicine and breast cancer genetics, and know your options. So we are just gonna open that up. And so basically, we really have come to see that over the past few years, that research has provided a new understanding in this realm of breast cancer genetics. And we've really been able to see that we can come at this from a prevention standpoint, but we can also come at it from a personalized medicine standpoint, which means we can understand more about oncotype and genetic properties that allow the treatments to be personalized to the individual, and then therefore be that much more effective and promote survivorship. And with that, rehab can also become more personalized as well. We know that environmental factors and healthy behaviors play a very important role in determining cancer risk, but we're really coming to understand that even like very healthy CrossFit athletes who did everything right from a health standpoint and pursued amazingly healthy lifestyles are still vulnerable and can still acquire very aggressive cancers. Because we've come to understand that some people unfortunately get cancer because it's written in their genetic code, I hope that changes society's perception that we don't merely have all the control all the time, and that some factors are non-modifiable and some factors are modifiable when it comes to risk of acquiring cancer. So that kind of promotes a theme that I like to bring into all my sessions, and that's removing the shame around a diagnosis. You know, people can't help but say, like, what did I do wrong? Where did I go wrong? I think it's so important to just create space in society as we learn more about genetics that maybe it was just in your genetic code. So, you know, genetic testing really sometimes offers up an opportunity to remove shame and start a new conversation. So we know that there are non-modifiable risk factors with cancer: family history, inherited genes, female gender, greater than the age of 55, having dense breast tissue, and actually being of Caucasian ethnicity. These are things you cannot change that actually do predispose you to being at a higher risk. We also have modifiable risk factors. These are things like nutrition, exercise, alcohol consumption, smoking, sun exposure, environmental carcinogens. These are things you can control and try to aim for having in moderation or a healthy approach to in your life. But we can see here that nurture versus nature is a bit of a play between these non-modifiable and modifiable risk factors. And for some people, despite getting all the modifiable risk factors right, they still end up with these terribly aggressive and unfortunate cancer journeys, with which demonstrates that there was probably a strong genetic tie. So with this comes this exciting field of personalized oncology and precision medicine and breast cancer treatment. We're really starting to see that you can understand more through genetics, such as kind of drug gene testing, and understand how drugs can be best metabolized. This can determine whether or not a drug is right for an individual. We're also starting to understand that you can understand properties such as HER2 sensitivities and hormone sensitivities. This too can help to optimize treatment. For example, the BRCA gene, which is one of the most common genes that is discussed in the field of breast cancer genetics, this is, if it's present, associated with an increased sensitivity to platinum-based chemotherapy drugs called PARP inhibitors. So that then there determines kind of what type of chemo an individual might be well suited for. Triple-negative breast cancers is an example that have no hormone sensitivities and no HER2 protein often carry a BRCA mutation, and this can be targeted with specific therapies as well. We also know that genetic testing can help determine oncotype, which is this new evolving field in personalized cancer care and treatment as well, which can help guide the treatment to be more personalized to the individual. So what do we know about breast cancer genetics? Well, we know that obviously breast cancer can be hereditary. It can involve one or more mutations in the BRCA1 or the BRCA2 gene. We know that the medical term now is actually HBOC, which is hereditary breast and ovarian cancer syndrome, if you carry BRCA1 or BRCA2. The reason we've started calling it a syndrome is so that that develops an awareness of the increased risk for other types of cancers. If a patient does carry a BRCA gene, there's an increased risk of acquiring ovarian, pancreatic, and possibly some other cancers. Females who carry this gene have an increased 70% increased chance of breast cancer onsetting prior to the age of 80. Men carrying this gene, I mean, that's an important area to discover and talk about that I don't think we talk about enough. If they carry a BRCA gene, have increased risk of prostate, pancreatic, and possibly other cancers. So once again, just understanding whether or not you carry BRCA or other members in your family do can open up a window of prevention. There are many other genes that are linked with breast cancer that we're starting to learn about, such as ATM and PLB2 and TP53, et cetera, et cetera. It's a very exciting field where we're really starting to learn more about the genetics associated with this common form of morbidity in female populations. So genomic testing innovation is really exciting and really evolving quickly. And this is just technology that allows us to genetically test and understand kind of what our genes are and if we carry anything. This is actually relatively non-invasive, believe it or not. It can be done through liquid biopsy, through saliva. It can be done through the mail. So this is a pretty exciting opportunity to offer these tests and to keep them accessible. So why would you consider genetic testing for breast cancer? I think this is the meat of the blog that everyone is wanting to get to. Here in Canada, the guidelines for genetic testing are still in development. So here there isn't really clear cohesion kind of within the medical community as to when it's necessary and when it's not. We're not really integrating mathematical models yet to guide this decision making. So this is why sometimes it's covered under MSP, other times it's not. This is why your medical oncologist might suggest it, they may not. Family doctor might suggest it, they may not. So I'm trying to spread this information so that people can understand the guidelines that are being shared in the States. The American Cancer Society has created a decision-making algorithm for when to test and when not to. So let's review that. So we do suggest breast cancer genetic testing in the case of what they're doing in the States for individuals with breast cancer who fall into the following: women diagnosed at a younger age, women with triple negative breast cancer, women who are of Ashkenazi descent, women with a family history of breast, ovarian, pancreatic, or prostate cancer, men diagnosed with breast cancer. So I can think of many patients of mine that have breast cancer, that have a family history of it. They mention very loosely that their mother had it or their grandmother had it. And they haven't pursued genetic testing. And I think that's very important to start to normalize these medical technologies. Individuals without breast cancer, that's like some of us, but fall within the following. This is also where we should get tested. If there's a known family history of the BRCA gene mutation, if there's a known family history of breast cancer at a younger age, if there's a known family history of a close family member with ovarian, pancreatic, or metastatic prostate cancer. So if you are a female whose father has metastatic prostate cancer, or whose father has a pancreatic onset of pancreatic cancer, according to this decision-making tool, you should be testing for breast cancer genetics. And I don't think that's the case for a lot of people whose fathers have pancreatic cancer. And last but not least, women without breast cancer, or individuals without breast cancer, but who are women with ovarian or who are men who are diagnosed with pancreatic should get tested. And I think that feeds into the one former where we're trying to think of the risks associated for other family members there. So the point is, family history matters. And I don't think we're utilizing these technologies to the full degree just yet. But from a prevention standpoint, they hold a lot of power. So if genetic screening isn't for you, you've determined it isn't an option, it's not affordable, or it makes you uncomfortable to share this information. There's a lot of variables going into this decision, and for some people, it's just not an option. Just simply knowing your family history is important, and therefore you can increase your screening and your monitoring through self-breast exams and whatnot to be aware of that. So, that's a very important tool we all have accessible to us. Because we know that if you have a first-degree relative, such as a daughter, sister, or mother, who's had breast cancer, that doubles your risk. And if you have two relatives, that increases your risk threefold. So diving here into the resource kind of section of the blog, these are companies offering breast cancer genetic analysis in North America, and they are all in the States. And I've listed a few here, and the links are all available on my website and on the blog. They, of course, offer slightly different packages and slightly different price points. So you can do your own research to decide what feels best for you, but there are options out there, and usually these methods are relatively non-invasive. So if you fall into one of the recommended categories above, which is actually more of us than we think, please consider speaking to your medical oncologist, or if you don't have cancer, speaking to your family doctor, or you can speak to us here at the Cancer Physio to start taking these first steps for genetic testing. We really know that a genetic test can be the gateway to more personalized treatment if you do have cancer, but it can also be the gateway to risk reduction if you don't. Thanks for your time today, and as always, thank you for your interest in science and rehab. Take care. Bye.